Dress Teen Stress. I'm Abba Shrestha, and welcome back to our Beyond the Brain series, where we interview health professionals about mental health in order to get a deeper insight of different aspects of stress and mental well-being. Today I'm here with licensed marriage and family therapist, Michelle Ritenour. Michelle, can you please start off by telling us a little bit about yourself?
Yes, thank you, Abba, for having me tonight. I am a licensed marriage and family therapist in California. I am currently working in a private practice in the Bay Area, and I work primarily with teens and young adults around anxiety, mood disorders, stress, relationships and friendships. And I've been doing this since 2008. And it's really just been, such a great experience. I was previously an elementary school teacher for 10 years. And so I've really loved working with young people, and it's kind of my jam. Yeah.
That's awesome. So, as we know, you're the founder and owner of Ritenour Counseling. So, what was your motive on starting this initiative, and what impact do you think it has created?
Um, Good question. So, like I said, I initially started off as an educator. That's what my training was in. But I always had an interest in psychology and mental health. In fact, I majored in psychology at UCLA for my undergrad and minored in education. So I decided to pursue the education route. But while I was teaching, I really discovered that you still wear the hat of sort of a mental health provider, really like working closely with young kids and supporting their learning, which oftentimes meant supporting right, some of the stress they were enduring, some of the family issues that were happening at home. And so I kind of reached a point where in my career I felt like if there was anything else I would do, what would it be? And it always led back into becoming a therapist, and then going through my own therapy in my 20s, right, I found out it was such a valuable experience just to be able to sit with somebody who was non-judgmental and could kind of guide me, and listen to issues that were more difficult for maybe my parents to hear, maybe my peers to hear. They didn't know how to handle it. So it was still such a great interest for me. And so I did go back to school in the evenings, and got my degree. And once I started doing my intern hours to get licensed, I kind of naturally fell into working with a lot of kids, working with teenagers, because I was already known in the area for working with young people in my role as a teacher. And then from there, I ended up growing my own practice. And I've been, working on my own. And in the past couple of years, I wanted to see what else, I could do aside from just sitting with clients. And as someone who is really into education, the ability to work with pre-licensed therapists, people who were learning, who were wanting to, get their license to be in the field and learn how to grow their own practices. It was a great opportunity for me to become a clinical supervisor, so that I could work with young therapists and their clients. And so that's how I began to grow my practice, is to have them working with me.
So, as a therapist, how do you usually handle dual relationships or potential conflicts of interests during your sessions?
Um, so it's not so much during our sessions as much as, you have to be careful about who you take on as clients. And when your therapists, like myself, live and work in the same community, there's a lot of overlap. So I do make sure that while maybe in our school community, I do have young kids in the community too. And so in their school community, while people know what my work is, I don't work with those clients. Those are the referrals that I will pass on to other colleagues in the area. Same goes with like people who maybe are at the gym with me, or people even just like running into at Target, that your interactions really are limited, or you're always keeping in mind confidentiality, that you don't know these people from somewhere else that's related to my practice. Um, but it also, I just to throw in, what's great about what we do is we're really into staying connected with good good providers in the area. And so I work really closely with a lot of other therapists, colleagues of mine, psychologists in the area, and they're the people I will refer to, so I can avoid the dual relationships. If there's some sort of conflict where I might know somebody, a potential client from somewhere else. Yeah.
And have you ever undergone therapy yourself? If so, like how has that influenced your practice?
So it's actually a requirement to get your license that you undergo a certain amount of therapy. Actually, a requirement, I believe, for graduate school, for your graduate program. So I did start out going to therapy again in my 20s, when I was experiencing sort of my own difficulties with stress, and navigating some of the challenges that you start to face as an adult in the world. And it was such a good experience for me again. And then through grad school, where you're required to commit to do a certain number of hours of therapy. And then, it is a tool and this is how I view therapy. It's a tool to use throughout your life. If you need to go in for a tune-up, you can work with a therapist. It's kind of like why we go to a dentist or a doctor. We get checkups, not just because something is wrong. So, I just feel like it should be a part of everyone's world. Yeah.
What do you think is the number one issue that you've helped treat or improve among your clients?
Oh, that's a good question. So, like I said before, I really have a focus around managing anxiety and stress, for young people. And I think the greatest strength of my practice, we focus primarily on connection, because if you don't have a great connection with your therapist, then you're not likely to share some of the things that are really bothering you, some of the deeper issues, some of the like thoughts and feelings that you work hard to hide from everyone else in your world. So that is my primary focus, is to stay really connected with my clients, finding the things about them that make them very special, very unique, making sure that they understand what those are. And then, be able to foster that trust, so that when it does come to maybe some like severe panic attacks, or maybe, right, just not being able to get to school, or maybe not being able to get out of bed to get on with your day, that they feel like, we're working together, you know hand in hand, to get them through that problem. So it's not so much the specific problem, but more just that a client can feel like they can really trust you, and that they're willing to take the risks to try and get better or do better.
And then now, like shifting a little bit more to the mental health side. So, have you personally experienced any kind of mental health issues, either now or growing up throughout your teenage years?
Mm, I think the hardest part for me was growing up in a family where, and I know a lot of people feel the same way, emotions are not a comfortable experience topic to address. And so I didn't have a lot of like emotional literacy and understanding what I was feeling and why, and then being able to communicate it to somebody who could receive it, who could listen and help support you. So I think that's probably one of my greater challenges. It's something that, as a therapist, right, I've obviously had to work on a lot myself in order to be able to support my clients with it. But it's not unheard of. It's something I feel like a lot of young people struggle with. I also work with a large population of maybe like second generation um, uh, teens where the parents maybe didn't grow up here in the Bay Area, maybe didn't grow up in California or in the United States, and so their approaches to dealing with when their kids are really struggling might look really different than maybe what the kids are needing. So I do work a lot. Just again, I'm bridging, right? Finding a common language, finding a way to like really communicate so that everyone can kind of hear each other in the family.
And then a common factor that's something you and I have, and
Mm.
anybody kind of watching, is stress. Obviously, you deal with it, any gender, any age, anyone. So, how do you think when we're talking about stress and coping mechanisms, how do you think your coping mechanisms from your teenage years till now has either evolved or just changed in a way?
Mm. Um, so I would say like the stress doesn't always change. Like I think you've recognized in this work that you're doing with everyone that that stress is very much just a part of our daily living. And I think part of what I've really worked on with my clients and also for myself is just the acceptance, right? Our lives are busy, they're stressful, and it's okay. It's okay to be that way. It's okay that you don't have to fix everything. You don't have to do everything. You don't have to be the best at everything. So really looking at, right, letting go of the perfectionism, letting go of some of the shame around it, and just, right, being okay with maybe not being okay sometimes and normalizing it in a way, rather than this sort of that hustle, culture and always sort of pushing yourself to be better and do better all the time. Sometimes you can just be.
So, kind of going back, you were talking about one of the things that you improve or help with your clients is anxiety. So, what are some tips that you have for teens that are kind of struggling with anxiety right now?
Um, I think this is something a lot of us do is say is just right. Good self-care is super, super important. I talk a lot about kind of digital detoxing, put your phone down, put it away, get off the computer, go outside. I really emphasize the importance of sleep. Most of my clients come to me with some issues around sleep. And, when you're not sleeping well, like nothing really goes well. So I work on a lot of kind of psychoeducation around how sleep works and how we sabotage our sleep patterns a lot of times. Um, and then on the other side of things, I do like to work with teens on just identifying values, like what's really important to you. Sometimes it's really hard because we don't know how to filter the noise out from what's important for our families, our parents, what they tell us, what our teachers tell us, what others expect of us. But that, you're at an age where you can start identifying the things that are helpful to you, and that, you know, that becomes very motivating. So the other noise around you won't matter so much.
And then kind of like a fun question, I would say a lot of the people that I interview like this question. What do you think are some misconceptions of therapy or misconceptions of mental health?
Oh, yeah. Okay, so, right, you're crazy. Like, that's always the one. You don't come to therapy to lay on a couch. You don't need to lie on a couch. There's a couch there. You can lie on it if you want to, but you really don't have to. People see like, right, the Freud's couch and all of that. But that it really, most of the people that I work with, and I would say a good percentage of my clients, like they just keep coming over the years because, like I said before, it's like going to visit someone for a checkup. So therapy it should be a comfortable place to land. It doesn't need to be like a go in and fix you in 10 sessions and you're done. I mean, some people might use it that way, but I view it as an experience as a provider for you that you can always have. Um, and it's right, it's part of your self-care. It's part of taking care of, who you are and what you want to be. And that it's supposed to be comfortable and it's not scary because that feels like what a lot of people feel like when they come in. Yeah.
All right. My last question to you is what advice would you give to someone that's struggling with their mental health or just like some kind of message that you would like to give to our Just Teen Stress audience?
Oh, I think the message of what I just said a few questions ago, just like sometimes it's okay to not feel like to be not okay. That we just have to get comfortable with being uncomfortable sometimes. We don't have to do it all the time. You don't need to be perfect at everything. You can just get out there and be you. So take the time to find out who you are. It's probably right. That's something. It doesn't matter if you're 15 or 25 or 35 or 55, really.
Yeah. So thank you so much, Michelle, for talking to us about mental health and your experience with it throughout your professional career, as well as thank you for helping us address teen stress.